Okay, hello everyone. I'm Christopher, Senior VP from TaxSlayer.com. Welcome everyone participating in this Affordable Care Act Q&A session. Here at TaxSlayer, we are ready for all of your ACA needs. If you're a returning user, I think that you will find that the ACA will be a painless process. So what I'm going to do is basically give you a basic overview of the ACA and how it may affect your refund amount to this upcoming tax season for this 2015 year, the 2014 return. Okay? And again, for the most part, it's a fairly easy process. The Affordable Care Act itself, basically, with this law in place, the government wants to know if you and your family have had health insurance in 2014 and also for the number of months in 2014. Okay? The questions you're going to be asked our software, do you and your family, independents, etc., have minimal essential coverage for all of 2014? And what is minimal essential coverage? Healthcare coverage provided by your employer, if you have health insurance for where you work. It could be a self-paid health insurance policy. Also, if you have purchased health insurance through the marketplace. And I'm going to talk about the marketplace in just a minute, healthcare liability, etc. Okay, you can also be under Medicare or Medicaid. That's also minimal essential coverage. Your family members who are in the military or veterans, they all have medical insurance, so that's also minimal essential coverage. Now, what you have to keep in mind is supplemental insurance. Someone has gone out and purchased a policy to take their activities at work. That is not minimal essential coverage. So if they bought a policy that covers their injured at work, that's not considered minimal essential coverage. Also, if you have just vision or you have just dental, that doesn't qualify either. So it has to be a medical insurance policy, either for your employer, through Medicaid, Medicare, veterans, etc. So what it's saying is there is no minimal essential coverage. If you have health insurance, you're going to be responsible for what they call a share responsibility payment. They call it a penalty. But that's the IRS term. It's called share responsibility payment. They don't like to call it penalty. That's the name of it, share responsibility payment. Okay? But it only applies to the months that you do not have health insurance. So they can't penalize you for the whole year. It's just for the months that you are not covered. Okay? But how is that share responsibility payment calculated? We've got the worksheet of software. It's going to take care of all the calculations for you, so it's not going to be that difficult. But just to give you a brief synopsis of how it's calculated, it's going to be higher two amounts. It's going to be 1% of your excess of your income over your filing threshold. And where is filing threshold? That is the amount that your amount of income required to file a tax return. Okay? For example, if you're married filing jointly, the government's going to give you a standard deduction of $12,400. You're going to have two exemptions for you and your spouse, at $39.50 apiece, $3,950 apiece. That's going to be $7,900. You add a $12,400 plus the $7,900. That's $20,300. So if you made less than $20,300, your married filing jointly is not going to be a share responsibility payment unless you got dependents involved, and I'll discuss that in just a second. But for the most part, that will be no issue. Okay? So if you're under the filing threshold, more likely there's going to be no share responsibility payment. Okay? Again, it could be it's 1% of that amount or $95 per quarter. It pops out at $285. Okay, so for example, if you're married filing jointly, you've got 3 children, you have no insurance, you made about $50,000. Your share responsibility payment will be around $300. So that's the most it would be. So again, if you made about $50,000, 3 kids, no insurance, that's the most it would be, and that would offset your refund, okay, or would be added to the balance too. However, you keep in mind 2015, next year, that 1% is going to increase to 2%, or it's going to be $325 per person, and assuming at $975. So this share responsibility payment percentage is going to go up every year that you don't have this year. So basically, the government is trying to get you to seek avenues to obtain medical insurance. And that's the purpose of this share responsibility payment. It's calculated on worksheet 5 on form 8965, which is the health coverage exemption form. You have all this set up for you in the software and calculated everything for you. And again, keep in mind, it's only going to, you're only subject to the sheriff's office payment based on the number of months that you don't have health insurance. Okay? And for example, if you, let's say that you and your family didn't have health insurance for the first 6 months, but the last 6 months of the year you did, you have to access this worksheet for it to calculate correctly. So it's not that difficult, but it's just in the software, and the buttons are there for the months that you do not have health insurance. Now, there could be some situations where you probably heard the term health coverage exemptions. Okay, and what that means is there's certain individuals out there that are not required to have health insurance, and the government cannot charge a sheriff's office payment. Okay? And just some examples of that, we just talked about one of them, that is the filing threshold, the income filing threshold. But there could be some situations where it's considered unaffordable. It could be a short gap. If you look at the 8965 instructions that are listed for you, members of Indian tribes are not subject to the sheriff's office payment. People that's incarcerated, also religious reasons, and also there's numerous hardship exceptions as well. But what you have to try to keep in mind is that these exemptions are pretty much must be granted through the marketplace, and it goes back to what is the marketplace. Okay? And I'm sure that everybody has heard of healthcare.gov. That's the marketplace for the federal government. And so what that is people go out to healthcare.gov and they obtain their insurance through this website that is subsidized by the government. Okay? However, there's state exchanges too. I think there's 17 states that you have a state insurance exchange. I believe like the state of New York has its own exchange. So, for example, if you live in the state of New York, you go to that state insurance exchange to get your health insurance. Or your state does not have an exchange, you would go back to healthcare.gov. And that's exactly what the marketplace means. Okay? So back to the health coverage exemption, if you say that you're not responsible for the share property payment, you shouldn't have to pay a penalty, you're not required to have health insurance, you have to obtain an exemption through the marketplace. Okay. What that means is you're not, when you're doing your return, you're not just allowed to check a box that I'm not subject to the sheriff's office payment. I'm not going to pay the sheriff's office payment. You have to go back to the marketplace to receive what they call an exemption certificate number. And you have to have that number to put into the system, in our system, to not pay the penalty. Okay, so again, it's not a whole lot of money. So you get the situation where you feel like you're not subject to the sheriff's office payment, you would have to go back to the marketplace. You probably don't want to do that if, because if you go back to healthcare.gov, it can probably take you weeks to get your exemption certificate, and they want to go ahead and file, etc. Okay? But for most instances, you're probably going to have to get an exemption certificate number that is required for 8965. However, there may be a couple of exemptions inside this trust where you do not have to get that exemption number. So again, that's all part of the Form 8965. The other thing that's could affect your return, for those of you who have gone to the marketplace, healthcare.gov, or your state insurance exchange, and you have received an advance payment, or your insurance company has received an advance payment from the federal government. Okay? This kind of ties into the fact that not everyone can afford medical insurance, so then that's where they come up with this 8% of your income, and you're not required to the government says if you or not if you if you have your income is not at 8% of your income cannot go to insurance premiums. That's where the marketplace comes in. So again, not everybody can afford these medical insurance premiums. So what this marketplace is doing is, for those who cannot afford a premium, this allows the taxpayer to go to the marketplace and seek insurance through this exchange. Okay? And what they've done is some of you have already received an advance payment. Okay, this is what they call a marketplace estimate. So this would have been happening in 2014. You could have went to healthcare.gov, put all your information, and you apply for your insurance premiums, and that money is paid from the government to your insurance company. Okay, if that's the case, and you have done that, you're going to receive, it's very important, you're going to receive Form 1095A. Okay? It's a health insurance marketplace statement. Okay? And if you do receive that document, you're going to have to fill out Form 8962, which is the premium tax credit form. Okay? And what this form does is basically it figures your premium tax credit and reconciles your advance payment. Okay? So again, keep in mind, if you receive a 1095A, you have to fill out Form 8962. Okay? So go to 8962 form, 1095A is required. We have all the menus set up. The way our system is set up, it'll tell you exactly what numbers to pull off the Form 1095 and plug into your Form 8962. Okay? Now, this form could lead to a larger refund, or it could lead to a refundable as well. It could also, you could possibly pay some money back. Okay? That's called an excess premium payment due. And what that means is, it's possible that you could have went to healthcare.gov and you underestimated your income. And then when you file your return, if you show more income, it's possible that you would have to pay the government back for those premiums that were paid to your insurance company. Okay, so that would be, it's limited, but if you estimate your income correctly with healthcare.gov, it should calculate pretty close to the tax. So again, we have all the information set for you, and plug the numbers in, it'll calculate it. Now, I mentioned the 1095 form. And what I want you to keep in mind is you may see some others in there. We talk about 1095A, that's the marketplace. If you go to healthcare.gov, which the insurance exchange, you will get Form 1095A. However, you may see 1095C this year, and that is employee provided health insurance offering coverage. And what that is your employer that covers you for health insurance, they will mail you this document that shows that you have minimum essential coverage. And it's not required for 2015 or 2014, but the IRS is encouraging voluntary filing. So these businesses are starting to see these documents out, so you may see that this year. Okay, that's 1095C is your employer is going to cover you for health or offers you health insurance plan, etc. You could also see Form 1095B. That's just the health coverage form, and that is from the insurance company. And that again, that's the same exact document. Pretty much, it shows all the months that you were covered for health insurance. So both of these forms, 1095C, 1095B, and 1095A, basically all show the same thing. They show the number of months that you had health insurance for 2014. Okay? They'll show a breakdown for not just you, your spouse, but also your dependents. Okay? Again, you may see some that's coming up. Okay, now for example, I'm employed by TaxSlayer, so I will receive 1095C from my employer. Okay? My mother, for example, is retired. She does not work. She's on my late father's insurance. She would receive Form 1095B from the health insurance company showing she has coverage. Okay, so again, these forms, you may see a couple of them for you this year, but they're going to be required in future years. So just keep the Form 1095A in mind. So when this is all said and done, it's only going to affect 3 lines of return. I talked about line 46 for return is your excess premium credit paid due. That's throughout the year. And what that means, if you went to the marketplace and you underestimated your income, you have to pay the IRS back. Then that's line 46. That's only if you went to healthcare.gov. If you didn't go to healthcare.gov, that does not apply. Okay? Line 61 on returns the share responsibility payment line. So if you owe a share responsibility payment, it's going to show up as a tax on line 61. And then right next to that is going to be a box on return, check box for your coverage. So if you're in the software and you say that you have health insurance for the entire year, for you and your family, you check that box yes. You check ask the question yes, so check the box. And that's all you have to do. It doesn't affect anything else. No share responsibility payment, no health mark, no premium tax credit itself. Okay, so it's not going to. That's a simple way of handling it. So if you have health insurance for the whole year, you ask the question yes, and you go on. And then you're going to have line 69. Premium tax credit, and that would be the refundable. So if you went to the marketplace and you're doing additional refund due to your sort of an advance payment of your insurance from the government to the insurance company, you would be possibly receiving an additional refund. But you cannot get additional refund unless you've already gone to the marketplace. So again, line 69 is not going to apply unless you went to the marketplace. Okay, so again, it's only going to affect 3 lines of return. We have all this program set up, all the things set up for you, so it's fairly easy to do. So again, TaxSlayer can handle all of your ACA needs, and I'm glad to answer any questions you have about the ACA. Right. Miles' question is, if you have health insurance, you don't have to worry about it. So if you have health insurance for the entire year, if you only have health insurance for part of the year, you're going to be responsible for the months that you're not covered. Or you have to get the exemption for the months you're not covered. Thank you very much for having me, and I look forward to a great tax season.